Right, Lauren, thank you. Now this, a new study suggests loneliness may be more harmful to older people than obesity, alcoholism, or even smoking 15 cigarettes a day. That is a startling headline. Dr. Marty McCary joins us now. Good morning to you, Doctor. I guess the question is, what makes loneliness so dangerous for our health?
It's not very clear, but what's very clear is that your physiologic reserve, your capacity to handle stress, goes down when you're alone. And we also see other downstream effects like less mobility, a decrease in muscle mass. Remember, lower muscle mass is the number one predictor of a foreshortened life. So this research suggests that the risks of loneliness may be as high as that of smoking or alcoholism or other risks.
Mm, very interesting and worrying for sure. I got now this one, everyone's talking about it, but dozens of people, doctor, suing the makers of different weight loss and diabetes drugs, claiming the companies have failed to notify patients of harmful side effects. The companies are fighting those claims. Let me ask you, what kind of side effects are we talking about?
Well, the side effects that people are concerned about are the slowing down of the GI system, what we call paresis of the stomach. Some people claim that their intestine are not moving. But I strongly disagree with the claim that the company does not warn people about it. It's very clear in the package insert, and doctors advise patients that that's in fact one of the reasons why these medications works. They slow down the motility and therefore slow down absorption. I've never heard of a case of it being permanent, as some of these claimants are saying, but these drugs are mimicking the normal hormones in the body, but anyone's entitled to a claim.
And what's annoying about it is that diabetes patients, with regard to Ozempic, they need it because it is effective in bringing down their A1C numbers, but they're finding it hard to get because people are buying it left, right, and center just to lose weight, which is not the intended purpose, right?
If we're serious about health equity, what we're seeing right now is a serious grab by people with power and access and money. And the folks who benefit the most are the folks who cannot afford it, the folks that may not have great access. And that's the community that many people are concerned about.
But to wrap it up before we move on to the next topic, do the benefits outweigh those potential side effects?
I think for most people, they do, although there are some questions about the long-term effect on reducing muscle mass. And a new generation of GLP-1 medications like Ozempic are going to attempt to reduce the muscle wasting that could be seen long-term.
Interesting. All right, I want to get to this one, Doctor. Surgeons just transplanted a genetically edited pig kidney into a living person for the very first time. Why is this such a huge medical breakthrough, and what are the implications?
Well, there's 500,000 Americans that get dialysis and about 100,000 plus that are on the wait list waiting for a kidney. There's not enough donors. And so if we can get organs from animals that are genetically modified to be rejected less frequently, then that could address the massive supply problem. Remember, 1% of the entire federal budget goes to pay for dialysis. That's how costly it is. And it's a significant burden. It can be miserable. So this may represent a milestone moment, but there are still some outstanding questions. Is there a risk of viruses transferring from the animal kingdom to humans? Is the rejection risk low enough to make it worthwhile? Those are questions that have led some to say this may have been a little premature, or maybe we need a little more research. We're not privy to all the preliminary data that the Harvard doctors had.
All right, we'll have to leave it there, but terrific stuff as always. Dr. McCary, thank you for joining us today.